Here is a terrifying number that most people never hear about. Within the first 6 months of moving into a traditional nursing home, research shows that nearly 1 in 4 residents will die. A massive study published in the Journal of the American Geriatrics Society followed over 15,000 older adults and found that the mortality rate jumped by 40% compared to those who stayed in their own communities. And that is not the worst part. The psychological damage starts even earlier. Depression rates among nursing home residents reach nearly 50% according to data from the National Institutes of Health. Loneliness becomes a daily companion. Autonomy disappears. The very places designed to care for our aging loved ones often accelerate their decline. But here is what the healthcare industry does not want you to know. There are alternatives. Real, practical, science-backed alternatives that can provide the support you need without sacrificing your independence, your dignity, or potentially years of your life. These options are not just wishful thinking. They are proven solutions that researchers have studied extensively and found to produce dramatically better outcomes. Today, I am going to walk you through 7 powerful alternatives to traditional nursing homes, ranked from good to absolutely life-changing. And when we get to number 1, you are going to discover a model that studies show can actually reverse the negative health effects of aging while costing significantly less than institutional care. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below. Now, without any further ado, let's get started. Number 7. Adult day care centers. Let me start with an option that many families overlook entirely. Adult day care centers provide structured programs during daytime hours, while allowing seniors to return home each evening. Think of it like daycare for children, but designed specifically for older adults who need supervision, social interaction, and assistance with daily activities. These centers typically operate Monday through Friday from early morning until late afternoon. Some even offer extended hours and weekend programs for families with demanding schedules. The research backing adult day care is remarkably positive. A study from the University of California found that participants showed a 37% reduction in behavioral problems compared to those without any structured daytime activity. Cognitive function improved measurably in adults with early-stage dementia. The social engagement alone produced significant benefits. Researchers at Johns Hopkins discovered that seniors attending adult day programs experienced 40% lower rates of depression than isolated peers staying home alone. Here is how these centers work in practice. Trained staff members supervise activities throughout the day. These activities include exercise classes tailored for limited mobility, arts and crafts sessions that maintain fine motor skills, music therapy programs, and group meals that encourage social bonds. Many centers also provide health monitoring services. Staff can check blood pressure, manage medication schedules, and alert families to any concerning changes. The cost factor makes this option particularly attractive. The national average runs around $75 per day compared to over $250 daily for nursing home care. That difference adds up to massive savings annually, while keeping your loved one in their own home. To get maximum benefit from adult day care, look for centers with staff trained specifically in geriatric care. Ask about the staff-to-participant ratio. The best centers maintain no more than 6 participants per staff member. Visit during operating hours to observe interactions firsthand. Notice whether participants seem engaged and happy, or simply parked in front of televisions. The key limitation here involves the need for evening and nighttime care. Someone must still be available when the center closes. This leads us directly to our next alternative. Number 6. In-home care services. Professional caregivers who come directly to your home represent one of the fastest-growing segments of elder care. These services range from a few hours weekly to round-the-clock support, depending on individual needs. The fundamental advantage is simple. You or your loved one stays in familiar surroundings while receiving necessary assistance. Research consistently demonstrates the power of aging in place. The AARP conducted a comprehensive study showing that 90% of seniors want to remain in their homes as they age. But more importantly, those who succeed in this goal show measurably better outcomes. A Harvard Medical School analysis found that older adults receiving in-home care maintained physical function 23% longer than those in institutional settings. Hospitalization rates dropped significantly. The comfort of home appears to provide genuine therapeutic benefits. In-home care divides into 2 main categories. Non-medical home care covers assistance with daily activities like bathing, dressing, meal preparation, light housekeeping, and companionship. Medical home health care involves skilled nursing services prescribed by a physician. This includes wound care, physical therapy, medication management by licensed nurses, and monitoring of chronic conditions. Many families combine both types to create comprehensive support systems. Finding the right caregiver requires careful vetting. Start by determining exactly what level of care you need. Be honest about current capabilities and anticipated future needs. Interview multiple agencies. Ask about background checks. training requirements, and supervision protocols. Request references from current clients with similar care needs. Once services begin, maintain regular communication. Good agencies welcome feedback and adjust care plans as circumstances change. Cost varies dramatically based on location and care intensity. The national median for non-medical home care runs around $27 per hour. Skilled nursing services cost more. However, Medicare covers qualified home health services when ordered by a physician. Long-term care insurance often covers in-home assistance. These financial resources make this option more accessible than many families realize. But what happens when in-home care alone cannot provide enough support? That brings us to a creative housing solution. Number 5. Accessory dwelling units. Here is an option gaining serious momentum across the country. Accessory dwelling units, commonly called ADUs or granny flats, are small independent living spaces built on the same property as an existing home. Picture a converted garage, a basement apartment, or a small cottage in the backyard. These units allow elderly parents to live just steps away from adult children while maintaining genuine independence. The psychological research here is compelling. A study from the Geriatrics Society of America found that seniors living in close proximity to family members while retaining separate living spaces reported 68% higher life satisfaction than those in institutional care. They experienced the benefits of family support without feeling like a burden. The arrangement preserved dignity and autonomy while ensuring help remained immediately available. Building an ADU requires navigating local zoning laws. Many cities have relaxed restrictions in recent years to address housing shortages. California, Oregon, and several other states now mandate that municipalities allow ADU construction in residential zones. Check your local regulations before beginning any planning. Some areas offer streamlined permitting processes specifically for units intended to house elderly family members. The construction process typically takes 3 to 6 months depending on complexity. Prefabricated units offer faster installation at lower costs. Custom-built structures allow for specific accessibility modifications. Either way, focus on features that support aging in place. Wide doorways accommodate walkers and wheelchairs. Zero-step entries eliminate fall risks. Grab bars in bathrooms prevent accidents. Good lighting throughout the space helps those with declining vision. Financially, ADUs represent a significant upfront investment ranging from $50,000 to $300,000, depending on size and location. However, this one-time cost compares favorably to ongoing nursing home expenses exceeding $70,000 annually. Many families recoup construction costs within just a few years. Additionally, ADUs increase overall property values and can generate rental income if circumstances change. The proximity arrangement works both ways. Grandparents can help with childcare. Adult children can provide daily check-ins and emergency response. Meals can be shared while private space remains available. This intergenerational connection provides benefits that researchers continue to document with impressive statistics. Speaking of intergenerational arrangements, the next option takes this concept even further. Number 4. Home sharing programs. Imagine this scenario. An elderly widow owns a 4-bedroom house that feels increasingly empty and difficult to maintain. Meanwhile, a young professional struggles to afford rent while working long hours. Home sharing connects these two individuals in mutually beneficial arrangements. The senior gains companionship and practical assistance. The younger person gains affordable housing. Formal home sharing programs have existed for decades, but recently experienced renewed interest. The National Shared Housing Resource Center reports that participation has increased by over 200% since 2015. These programs carefully match participants based on lifestyle preferences, expectations, and needs. Some arrangements involve reduced rent in exchange for specific tasks like grocery shopping, yard work, or evening companionship. Others simply split housing costs, while each party maintains independent routines. The evidence supporting intergenerational living arrangements is substantial. Research from the Stanford Center on Longevity found that seniors in shared housing situations experienced 47% lower rates of cognitive decline compared to those living alone. The daily social interaction appears to provide crucial mental stimulation. Physical health improved as well. Having another person in the home increased the likelihood that medical emergencies received prompt attention. Getting started with home sharing typically involves connecting with a local program. Area agencies on aging often maintain lists of established matching services. Some communities have nonprofit organizations dedicated specifically to this purpose. The matching process includes background checks, interviews, and trial periods to ensure compatibility. Written agreements clarify expectations around finances, household responsibilities, privacy boundaries, and conflict resolution. This option works best for seniors who remain relatively independent but need occasional assistance or simply want companionship. Those with significant medical needs may require additional support beyond what a housemate can provide. Clear communication from the beginning prevents misunderstandings that could damage the arrangement. The financial benefits are substantial for both parties. Seniors can afford to remain in homes they might otherwise need to sell. Younger people access housing markets that might otherwise exclude them. Some programs report average savings of $12,000 annually for participating seniors. Now let us explore an option that combines professional care with community living. Number 3. Continuing care retirement communities. Continuing care retirement communities, known as CCRCs, offer a comprehensive approach to aging that eliminates the trauma of multiple moves. These communities provide independent living, assisted living, and skilled nursing care, all within one campus. Residents can transition between levels of care as their needs change without leaving their community or their social connections. The longevity data from CCRCs is remarkable. A study published in the Journal of Housing for the Elderly followed residents over 15 years and found that those in CCRCs lived an average of 4 years longer than peers in traditional nursing homes. The researchers attributed this difference to several factors. Preventive health services caught problems early. Social engagement remained consistent throughout declining health. The stress of relocating during medical crises was eliminated entirely. Life in a CCRC typically begins in independent living. Residents occupy apartments or cottages with full kitchens and private spaces. They manage their own schedules while having access to community amenities like fitness centers, pools, restaurants, and activity programs. As needs increase, residents can transition to assisted living where staff helps with daily activities. Finally, skilled nursing provides round-the-clock medical care when necessary. The entrance process for CCRCs requires careful financial planning. Most communities charge substantial entrance fees, ranging from $100,000 to over $1 million, depending on location and accommodations. Monthly fees then cover ongoing services. Some contracts refund portions of entrance fees to estates. Others offer rental models without large upfront payments. Understanding the specific contract type is essential before committing. To evaluate CCRCs effectively, visit multiple communities during regular operating hours. Eat meals in the dining room. Attend activity programs. Talk with current residents about their experiences. Ask about staff turnover rates. High turnover often indicates management problems that affect care quality. Review the community's financial statements. A well-managed CCRC maintains reserves to honor long-term care commitments. The main drawback involves cost and availability. Quality CCRCs often have waiting lists extending several years. Planning well in advance becomes necessary. For families seeking this model, begin research and get on waiting lists long before care needs become urgent. Moving toward our top 2 options, we find solutions that completely reimagine what elder care can look like. Number 2, the Greenhouse Project. Traditional nursing homes operate like hospitals. Long hallways connect private or semi-private rooms. Centralized nursing stations monitor dozens of residents. Meals arrive on trays at scheduled times. The Greenhouse Project completely inverts this model, and the results have stunned researchers. Greenhouse homes are purpose-built residences housing 10 to 12 residents who live together as a family unit. Each person has a private room and bathroom opening onto shared common areas, including a full kitchen where meals are prepared. Staff members called Shabazim handle all care needs from assistance with bathing to cooking to housekeeping. These workers develop deep relationships with residents rather than rushing between dozens of patients. The research outcomes speak for themselves. A study funded by the Robert Wood Johnson Foundation and published in Health Affairs found that greenhouse residents experienced 50% fewer hospitalizations than traditional nursing home residents. Pressure ulcers, those painful skin breakdowns common in institutional care, occurred at rates 96% lower than nursing homes. Staff turnover dropped dramatically as well. Caregivers reported higher job satisfaction when they could form meaningful connections rather than simply completing tasks. Quality of life measurements improved across every metric studied. Greenhouse residents reported feeling at home rather than institutionalized. They maintained greater autonomy over daily decisions. Depression rates fell significantly. Family members visited more often because the home-like environment felt welcoming rather than clinical. One researcher described walking into a greenhouse and smelling dinner cooking rather than disinfectant. That sensory difference reflects a fundamental philosophical shift. Finding greenhouse homes requires some searching. Currently, over 300 exist across the United States, with more under development. The Greenhouse Project website maintains a directory of locations. Costs typically compare to traditional nursing homes, and Medicare or Medicaid covers care just as it would in conventional facilities. The challenge lies in availability. Many greenhouse homes have waiting lists because demand far exceeds supply. If a greenhouse option exists in your area, prioritize visiting before any nursing home consideration. The difference in atmosphere is immediately apparent. Ask residents about their daily experience. Observe interactions between Shabazim and residents. Notice whether people seem engaged with their surroundings or withdrawn and passive. Now we arrive at the most important alternative of all. This option has produced study results so positive that researchers initially questioned their own data. Number 1. The village model. Picture this alternative future. You remain in your own home as you age, but you are not isolated. You belong to a network of neighbors who look out for each other. You have access to vetted service providers who help with everything from transportation to home repairs to medical appointments. Social events keep you connected. Exercise programs maintain your strength. Volunteer opportunities give your days purpose. This is the village model, and it may represent the most revolutionary development in elder care in decades. Villages are membership organizations created by and for older adults who want to age in place. The first village, Beacon Hill Village, launched in Boston in 2001. Today, over 350 villages operate across 45 states, with new ones forming regularly. Each village reflects its local community while sharing core principles of neighbor helping neighbor, supplemented by professional services. The research supporting this model has exceeded all expectations. A landmark study from the Johns Hopkins Bloomberg School of Public Health tracked village members over 4 years. The results showed that members experienced significantly slower rates of physical and cognitive decline than non-members living in the same communities. Hospital admissions dropped, depression decreased. Perhaps most remarkably, members reported increases in quality of life measurements rather than the typical declines associated with aging. Here is what makes villages work. Members pay annual dues typically ranging from $400 to $800 for individuals or couples. In return, they gain access to a coordinator who helps arrange services. Need a ride to the doctor? The village has volunteer drivers. Need help changing light bulbs or picking up groceries? Members assist each other, or the village connects you with vetted providers at negotiated rates. Want social engagement? Villages offer regular programs from book clubs to exercise classes to educational lectures. The peer support element proves especially powerful. When members help other members, both parties benefit. The helper gains purpose and social connection. The recipient receives assistance without feeling like a burden. This mutual aid creates psychological benefits that paid services simply cannot replicate. Researchers note that village members describe feeling part of something larger than themselves, even as their physical capabilities diminish. Starting or joining a village requires community organization. If no village exists in your area, the Village-to-Village Network provides toolkits and technical assistance for launching new chapters. Founding a village typically takes 18 months to 2 years and requires dedicated volunteer leadership. If a village already operates nearby, joining involves completing an application and paying membership dues. To maximize benefits from village membership, participate actively. Attend programs even when you feel like staying home. Volunteer to help others even if your contributions seem small. Build relationships with fellow members before crisis needs arise. These social connections form the true foundation of the model. The services matter, but the community matters more. The financial equation makes villages remarkable. Annual dues of a few $100s compared to nursing home costs exceeding $80,000 yearly. Even adding professional home care services, village members typically spend a fraction of institutional care costs while reporting better outcomes and higher satisfaction. This is the future of aging. Not warehousing our elders in hospital-like institutions, but supporting their desire to remain independent, connected, and purposeful. Every study measuring village outcomes finds the same patterns: slower decline, better health, greater happiness, longer independence. The evidence is clear. Alternatives to traditional nursing homes exist. They work, and in many cases, they work dramatically better than institutional care. Whether you choose adult day programs, in-home services, creative housing arrangements, or community-based models like villages, you have options. Your loved ones have options. The choice between institutional care and isolation is a false choice that the healthcare system has perpetuated for too long. Start researching these alternatives now. Do not wait for a crisis that forces rushed decisions. Visit local options. Talk with families who have navigated these choices. Build the support network that will allow you or those you love to age with dignity, independence, and genuine quality of life. The science says it is possible. Thousands of families have proven it works. Now you know what to do instead. Have you or someone in your family tried any of these alternatives to nursing homes? I would love to hear what worked and what challenges you faced in the comments below. Now, we want to hear from you. Have you or someone in your family tried any of these alternatives to nursing homes? What worked for you and what challenges did you face? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.